If you've got ADHD, it is so much more than just struggling to focus, right? It's this constant battle with that inner critic, the one that just never seems to quit. So, what if you had a practical, science backed user manual for your brain? Well, that's exactly what we're going to dive into today. We are going to demystify cognitive behavioral therapy, you probably know it as CBT, and show you how it's this incredibly powerful toolkit for managing adult ADHD.
All right, so here's the game plan. We're going to walk through 5 key areas. First up, that internal struggle we just talked about. Then, we'll see how CBT can act like a bridge for your brain. After that, we'll get super practical and open up the toolkit. Then we'll look at the proof. Does this stuff actually work? And finally, we'll zoom out and look at the bigger picture.
Okay, let's kick things off with section 1, the ADHD internal struggle. Because look, before we even think about solutions, we have to get real about what it actually feels like. We need to understand why this is so much more than just a simple lack of willpower. Does this sound familiar? I am a failure because I got distracted again. Yeah, this kind of negative thought just pops into your head automatically, and it's incredibly common. It's that nagging voice, right? The one that takes a simple, tiny moment of distraction and blows it up into this huge, harsh judgment about who you are as a person. And this isn't just some random bad feeling. It's a core challenge that CBT is designed to tackle head on. And this right here is the most crucial point I want you to take away. This struggle is not a moral failing. It's not you being lazy or not trying hard enough. It's neurobiology. It's science. Your brain literally works differently, especially in how it uses key neurotransmitters like dopamine. And once you really get that, everything shifts. The focus shifts from blaming yourself to empowering yourself. See, it's not about trying to fix a broken brain. It's about learning to work with its unique wiring. So, okay, we've laid out the struggle, we get it. The question is, how do we start to build a bridge over that gap? Well, that brings us right into section 2, CBT. This is all about learning to connect our thoughts, our feelings, and our actions in a way that actually helps us instead of hurts us. So what exactly is CBT? Well, at its core, it's a really structured and practical approach. Unlike some therapies that dig way back into your past, CBT is all about the here and now. It's focused on what's happening today. It's designed to give you actual tools you can use to identify and change those unhelpful thought patterns and behaviors that are causing you trouble right now. And this is really the core of how it works. It's this simple but incredibly powerful loop. Let's walk through it. It all starts with a single thought. Something like, ugh, I'll never get this done. What happens next? That thought immediately triggers an emotion. You start feeling anxious, totally overwhelmed. And then what do? Well, that feeling leads to a behavior. You procrastinate. You go watch TV. You scroll your phone. You see the cycle? CBT is all about learning how to jump in and break that chain, usually right at the beginning, at the thought level, before it spirals out of control.
All right, which brings us to the really good stuff, the practical part. This is your ADHD toolkit. We're going to look at 2 huge strategies here. First, building what's called an external brain to help with organization, and second, learning how to directly fight back against that inner critic.
Okay, so the first tool, building your external brain. Since ADHD can make things like planning and memory a real challenge, the idea is to create support systems outside of your own head. This means things like breaking down those huge, overwhelming projects into tiny, bite-sized steps. It means actually using your planners, your calendars, your phone timers, like all the time. It's about creating daily routines that become so automatic you don't even have to think about them. And of course, organizing your space to get rid of distractions. The goal here isn't to force yourself to be more disciplined, it's about building a smarter environment that works for you. And here is a fantastic, super simple trick for getting started on anything. It's called the 10-minute rule. We all know the hardest part is just starting, right? So here's the deal. You just commit to focusing on that dreaded task for only 10 minutes. That's it. Anyone can do 10 minutes. And what's amazing is that more often than not, that's all you need to build a little momentum and push right through that wall of resistance. Okay, now for this second part of the toolkit. This is the mental game. It's all about fighting back against that inner critic. So, how do you do it? First, you just learn to notice those negative thoughts when they pop up. Then, you challenge them. You put them on trial. You ask yourself, wait a minute, is this actually 100% true? Am I a complete failure, or did I just get distracted for a moment? It's a process of practicing self-compassion and learning to reframe those nasty all-or-nothing thoughts into something that's way more balanced and, frankly, way more realistic. And for anyone who struggles with impulsivity, here is an absolute game changer.
The 10-second rule. It is so simple. Before you react, before you say the thing, before you make that snap decision, just pause. Count to 10. That tiny little gap is everything. It creates just enough space for you to go from a knee-jerk reaction to a thoughtful response. It's a deceptively simple but incredibly powerful way to get back in the driver's seat. Okay, so these tools sound great, right? But I get it. The real question is, do they actually work? Is there proof? Let's dig into the science. Welcome to Section 4, Proof and Best Results. So the research is pretty clear on this. While medication can be a huge help for a lot of people, the absolute best results usually come from combining it with CBT. Think of it like this. Medication can clear the fog in your brain. It helps with focus on a chemical level, basically creating this window of opportunity. But, and this is a big but, it doesn't magically teach you how to organize your time or plan a project. That's where CBT comes in. It gives you the actual skills to use that window of clear thinking effectively. They really work together, hand in hand. But that brings up a really interesting question, doesn't it? Are all the different parts of CBT equally effective? I mean, if you want the most bang for your buck, where should you focus your time and energy? Well, the research has an answer, and this chart lays it out perfectly. Studies show that some parts of CBT are way more powerful for ADHD than others. Just look at those two big bars on the left. What are they? Mindfulness and acceptance, and those practical organizational strategies we talked about. They have a really high impact. Now, look at that little bar way over on the right. That's psychoeducation, which is basically just learning about ADHD. On its own, it has a pretty weak effect. The takeaway here is crystal clear. Doing the work and building awareness is way more effective than just passively learning about the problem. All right, we're almost there. For our last section, let's zoom out and look at the bigger picture. Because this isn't just about a handful of tools. We also need to talk about boundaries, why adaptation is so important, and taking a whole person view of well-being. And we have to be honest here. Standard textbook CBT can actually be pretty tough for an ADHD brain. I mean, sitting through long, abstract therapy sessions, that can be a real struggle for focus. And remembering to do the homework between sessions, that can feel like a whole other mountain to climb. That's exactly why adapting the approach is so crucial. Things like shorter sessions, using more visuals, and keeping the focus on practical, hands-on, real-world stuff can make all the difference. Okay, this next part is incredibly important if you're looking for help. You need to know the difference between an ADHD coach and a clinical therapist, because they are not the same thing. A coach is like a partner. They help you build skills for the future, set goals, get organized, but they cannot diagnose you. A qualified therapist, on the other hand, can diagnose you, and they can also help you work through things like past trauma or co-occurring conditions like anxiety and depression. Knowing the difference is key to making sure you get the right kind of support for what you actually need. And just remember, CBT is an amazing tool, but it's still just one piece of a much bigger puzzle. A truly holistic approach brings in all the lifestyle factors too. We're talking about exercise, good sleep, nutrition. Take exercise, for example. It's not just some vague good-for-you thing. It directly boosts those key neurotransmitters, like dopamine, that are at the very heart of the ADHD experience. Think of it as another powerful, essential tool in your toolkit. So I want to leave you with one final thought to chew on. What if we completely reframed this whole conversation? What if we stopped seeing ADHD as a deficit that needs to be fixed and instead started seeing it as just a different operating system, a different way of being wired? And if that's true, then maybe, just maybe, tools like CBT are the user manual you've been looking for to finally learn how to master it.